So it's both a little bit of a stigma, I think, to express anything other than just kind of happiness and joy at being a new parent.
It's not just the grief, in this case, potentially of like a loss of a child. It's the grief of the loss of what could have been.
It can also be something that ties in with a traumatic pregnancy and can be a potential risk factor for developing postpartum depression.
Hi, welcome. My name is Catherine Sims. I'm the clinical director at the Integrative Trauma Treatment Center, and today we're speaking with Erin Fanshier. She is a licensed clinical social worker at the Integrative Trauma Treatment Center in Portland, Oregon. The podcast is called Unspoken, and for me, Unspoken is the things that we individually as a culture are afraid to share and say for a variety of reasons that keep us from either living our authentic selves or being able to show up genuinely in a space. What does unspoken mean to you?
Yeah, I actually have two answers for this because when I first started thinking about it, what it means to me is I do a lot of somatic work. Like that's really something I love to do as a clinician. A lot of the interventions I do are really about like embodiment and kind of getting in touch with your body. So I think of unspoken as, maybe things that like we can't say, but we feel in our bodies, maybe that our nervous system is telling us, kind of ways you can tell a story through your kind of sensations rather than through words. But then I also just yesterday had a client say in session that their trauma made them feel like they didn't have a voice. And that was so just like part of what was so traumatic about their experience to me. So I like just connect with that so much as like it feels like your voice was taken from you. So in any way to, be able to just say whatever you want to say. And maybe you want to tell your story. Maybe you just want to scream. Maybe you just want to say something else. But just getting the opportunity for that.
Erin is here to talk with us about prenatal and perinatal care and mood and anxiety disorders. So tell me, how did you get into this?
Yeah, so I, in my work as a counselor, I used to work with early childhood and infant mental health, which I really loved, and was a lot of work with the parents and sometimes doing work with parents who were pregnant and kind of helping them with child attachment. And I just kind of shifted to getting an interest in working with that stage of life. I found really interesting. And here in my work at the trauma center, I work with a lot of different types of trauma. And this one I just felt is really, it's like really interesting to me. And it's a stage of life that a ton of people go through, obviously. And it isn't something that is often as talked about. And what I find personally for myself as well is I am not a parent and I've never been pregnant. And in a way, I find that really to be helpful, to have it not be a traumatic experience that is something I've personally experienced. To have a little bit of distance there, but a lot of people in my life have gone through mood disorders with pregnancy and complications and trauma. And I'm just really passionate about getting help for those who have.
Do you find that people often don't know that there's specific support around perinatal care for them?
Yes. Ever since I have kind of expressed my interest in this field, I have gotten so many questions, like personally, professionally, friends of friends, people I know in my life who just kind of reach out and say that somebody is struggling or they're struggling. And I think there is a lot of information about what it was commonly known as like postpartum depression. Now I think the umbrella term is just perinatal mood and anxiety disorders. But that was really helpful, I think, to get a lot of knowledge out there about postpartum depression. But I think the idea of trauma associated with pregnancy is something that a lot of people don't know about, don't know that what they experienced was traumatic, and don't know that there are professionals that specialize in that area. And there's specific resources.
Yeah. I know that the DSM-5, when it came out, however long ago now it was at this point, made some changes around perinatal care, perinatal depression. Do you feel like there's still changes coming that need to be addressed?
Yeah. I think there definitely is. There was, as far as I know, some of the research studies in this on pregnancy trauma started with a doctor of nursing, Cheryl Beck, and I think 2006, 2007, there were some studies published about pregnancy trauma that were really some of the first time that specific area was getting studied. And yeah, I think there's going to be a lot more information coming out, and hopefully there will be changes as well. Like once more people are able to just kind of connect their experience to like what is happening to them and like give a name to it.
Yeah. Why do you think it's been an area, counseling and therapy is becoming more widely accepted. The stigma is reducing, I'd like to think. And that's been my experience with it. Why do you think this area has taken a little bit longer to bring awareness to women and families that have gone through some of these things?
Yeah, I think there's a few different reasons for that, and something that I have read repeatedly and I've heard expressed by a lot of people I've worked with is if you're pregnant, once you have a baby, if the baby is healthy, it's kind of expected that you're fine. Like you have reached the goal, it is over. And also this idea that like, well, millions and millions of people give birth every year. It's just part of the life experience for many people. So why is this bothering you? Like, why is this considered traumatic, or why are you experiencing anxiety or depression? So it's both a little bit of a stigma, I think, to express anything other than just kind of happiness and joy at being a new parent, specifically a new mom. And I think that a lot of people who are experiencing it just start to think like, well, this is just like the hormones, or this is just me kind of not being able to handle it. So it's something that you just don't really talk about.
Like dismissive of your own experience.
Yeah. And there's something really common that I've heard a lot is this, like other people have it so much worse, or like, why should I be upset because my baby was healthy and fine, even if the birth itself was really traumatic? It's just sort of, dismissing your own experience, or there's a lot of focus too on the baby once the baby's born, of course, because it's very exciting and they're very cute. And what I've heard from a lot of new parents as well, their experience is, people rush in the room and you're just kind of a body. Like you're not a person anymore. Everything is about getting this baby safe. And then once the baby's born, like your identity is now like mom, and just everything about you is like how you are keeping like this baby alive. And there's kind of just less attention paid to like, what was this experience like for you?
Yeah. Is it safe to say that the healthcare system plays into that dismissal?
I would say so. I definitely think so. And that is something that I've also read, very common kind of example of what happens, and something I've heard from a lot of people as well is for the medical system, maybe doctors, nurses, clinicians in the hospital, this is an everyday thing. It's, you work in labor and delivery, like, so as well, something that like to a new mom, like she might consider the birth to be really traumatic because of what happened, if there were medical interventions or any complications, a longer labor. But to all the professionals, they might just say, well, yeah, this is fine, and the baby's here and it's fine. So there's not a lot of attention to be paid to that individual experience. And, there's a lot of reasons for that. Like their job is there to make sure the mom is alive, baby's alive. So there can be this idea of just kind of get things done. And I think there's a lot of post-traumatic stress in the healthcare field as well surrounding it that kind of creates a numbing effect.
Yeah. So do you find yourself doing a lot of education in your session with clients? I mean, maybe the ones who do that dismissal of their own experience? And do you find that you're kind of walking them back a little bit and reorienting them to what actually they have gone through and bringing some of those things into awareness?
Yeah, definitely. And that's something that has been really helpful for me is reading the research and the studies that have validated that PTSD following a traumatic birth or traumatic pregnancy loss is a real and valid diagnosis. And I think in general, a lot of the clients I work with here sometimes don't really understand what PTSD is in general. So there's always a little bit of education. And again, because giving birth, being pregnant is something that many people view as like just a really common life experience. Some of these clients who may have had a traumatic pregnancy or traumatic birth don't see how this could be traumatic, right? Like they see trauma as, a big accident, like going to war, something where you feel such a threat. So just being able to say like, hey, the symptoms you're describing, like they may align with PTSD or depression or an anxiety disorder. And, that kind of makes it real. And here's how it's connected to what happened to you, and just like normalize it and give a little bit of education about, don't just try to ignore it and, think it's just going to go away.
Yeah. I know there's a lot of different answers to this next question, but in your experience, when do you find that people reach out during the process of becoming a parent, pregnancy, going through birth, all of those things? What's the experience? When's the most common time? Is it after? Is it during and right in the middle of pregnancy? What's your experience?
Yeah, that is a really interesting question. And I have, I think in my personal experience, something I've noticed is clients or new parents who have had a previous traumatic event, either a pregnancy loss or a traumatic birth, and are now pregnant again or are trying to conceive and are wanting to kind of process the last experience. And I've also found following birth about, maybe 6 months plus old, where there's actually been more and more referrals from health clinics and pediatricians, which I think is really great to see, because that's a good way to work with this, is to screen and notice it and then refer. So I do think it's after the very, very first few weeks newborn phase where there is a little bit of just the common like baby blues due to like hormone levels, and then like adjusting to having an infant in the home. And once you've been feeling a certain way for a few months afterwards, I think some of the new parents start to realize like, okay, something is really wrong. So then that's when they start to come in.
Yeah. Something's up. They're just not kind of feeling the way that they had maybe expected to feel at that point in time.
Yeah, I think that's common for the depression is, feeling, I should be feeling like this joy, like this overwhelming, happiness feeling, and I'm just not. And it's different than I'm tired. And something that's kind of interesting is checking with a new mom too, to say like, of course you're tired. Like that's a given, but like when you sleep, like, do you feel rested, or do you can't sleep, or you can't feel well rested? And that can sometimes be a sign like, okay, something more is happening. And for anxiety and trauma, it can often be like replaying it in their head is like what I've heard of, I keep getting flashbacks, or I keep thinking of it over and over again, and realize, okay, it's been a while now and this isn't really going away.
I love hearing that you are noticing an increase in pediatricians preferring moms or parents to your caregivers. I guess that kind of plays into that idea that healthcare has a dismissive quality around women and this and birth and bearing a child, because that's another area where the focus is really on the child. It's very intentional for a pediatrician to shift focus onto the parent or the caregiver and ask how they're doing as well.
Mm-hmm. Yeah, definitely. And that has been some of the recommendations as well for pediatricians to use the prenatal checkups and postpartum checkups and well child visits as an opportunity for intervention and screening. using this as an opportunity to, you brought the baby in, so I'm going to have you do this depression screening, or just kind of check in on your own mental health, because it may not be feeling a certain way like during the pregnancy, but after the birth. And for a lot of new parents and a lot of moms, like they are going to put their child first. So they might put off getting themselves mental health or health care, but they will be taking their baby in for the well child checkups. So that's a really good opportunity to make sure you're checking in on everybody.
I'd love to see that be a standard of care. It'd be just amazing.
Yeah, definitely. Just like more screenings. And I know we've seen an increase in that with depression screenings in healthcare. So I think it is becoming more kind of integrated, but more is always better.
Yeah, more is always better. In this case, absolutely. Tell me a little bit about, I know that you have a couple of different areas, anxiety, pregnancy loss, that are special to you. Tell me a little bit about what you notice around anxiety levels and how anxiety interplays with pregnancy.
Yeah, I think anxiety is another really tricky one, because a lot of times that is just going to be brushed off as like, well, that's normal. Like, of course you're anxious. Like new moms, new parents are always anxious, which, it is true. But as clinicians, we know that there's a difference between, kind of a feeling of anxiety or nervousness and something that raises to a clinical level, that it's interfering with your ability to kind of live your life the way you want to live. And I think where I see that often is postpartum, being home with the baby for the first time. Of course, there's anxiety is normal, but there can be kind of a real fixation on what is and like what is not in your control, and something's going to happen to the baby. And there can be a big connection between a traumatic birth experience and anxiety as well, of feeling like, oh, like we got through this, but now like what is going to happen next? And often, since it is usually like the mom who's pregnant and is home on maternity leave for a while, there can be a lot of isolation happening too, staying home with the baby
and and therefore being more vulnerable to depression as well then too.
Oh yeah, definitely. Just feeling like your identity has totally changed and shifted, and there definitely can be the isolation and a little bit of loneliness, and so many opportunities to feel like you're doing something wrong is what I think I hear of a lot of, I'm having trouble breastfeeding or latching or sleeping, or I'm not feeling this amazing like parent love that I should be feeling. Like there's a lot of messages that new parents have that they aren't like living up to in some way. And then that can really start to ruminate and be really difficult.
Yeah, kind of damaging. There is it's like a not meeting your own expectations for what you thought it was going to be like. And not even your own expectations, the messages, as you sort of mentioned, that you're fed and that get into your psyche and into your being about what this experience is going to be like. And when it doesn't meet, like most things, right? When and if it doesn't meet those expectations, it can feel really defeating.
Yeah, it definitely can. And I think that's true with so many things in life. And this is just another life stage, another experience where that has an opportunity to happen, where either what you're seeing in the media or maybe even from your own family of origin, like expectations, a lot of comparison to other moms or other parents of how you should be feeling or responding, and then being really hard on yourself for not living up to it.
Yeah. How often do you, I know this is not really a quantifiable question, but how often do you think you see clients who come in who have been in this place for years, where they've got a child who's 3 or 4 and the anxiety has just never gone down, but that they didn't even really connect it to the experience of becoming a parent?
Yeah, I think that this happens fairly often. And that was actually something that really kind of started my interest in working with the perinatal and pregnancy period. At my the previous work I did, part of our work on parent-child attachment was getting a timeline of the pregnancy and what it was like for the mom. And there were often a lot of periods of traumatic or stressful events that happened and going through the birth story itself, I would be really, shocked to hear about some of these experiences and learn that like these parents like had never really ever gotten support for it before or talked about it. And in those cases, some of the kids I was working with were, up to 10 or 12 years old. And I think part of that is, again, with time, like we're getting more information, maybe at the time when like the parent went through that pregnancy and birth, there wasn't a lot of information. But they just, a lot of them, the common thing I heard was like, I just became a mom and then just everything was about that. It just kind of put my own needs to the back burner. And so sometimes it does take something like another pregnancy or another trigger coming up to realize this is something they've been experiencing.
We've talked about, of course, your interest in perinatal care. That's really what we're talking about. But I know you have a special interest in pregnancy loss. Can you tell me a little bit about that and how that is different or kind of captures your attention and focus?
Yeah. I think that is another aspect of this that is, again, just not really talked about enough. And the ways I think that we're talking about it have really started to shift as a culture. And again, it's something that I think is really important. And it can also be something that ties in with a traumatic pregnancy and can be a potential risk factor for developing postpartum depression or postpartum PTSD or anxiety disorder is a loss or previous loss. So I think it's just really important to talk about, to like capture as a part of someone's story. And it's really something that I've just learned over the years through my clients, like how loss impacts them in different ways. And I've just found that to be really interesting. Talking to a client who, had loss 10, 20 years ago and maybe went on to not have any more children, but still considers that, going through a pregnancy and like being a mom to a different degree. And it isn't really talked about enough. I think it's something like 25% of first pregnancies like can end in miscarriage. So I think as well, it sounds like something that's so common. And can also, again, bring up those feelings of shame, right? Of like, I did something wrong. Or there can also be shame as well. And, some parents I've worked with maybe they aren't as impacted by it and they just have kind of a different outlook on what it means to them. And, again, there can be shame around that, around I'm not grieving enough or I'm grieving too much. I just find that really interesting. Like it's so individual and a really good way to just, I don't know, get to like explore thinking about like that loss and like what it means and like normalizing it. And I think just having more people comfortable talking about their story is, good for everybody.
Grief is one of those things too. I know that I find this in my work where it's not just the grief, in this case, potentially of like a loss of a child. It's the grief of the loss of what could have been. It's the loss of what you thought you might be thinking and feeling at this particular point and juncture in time. So I guess you're probably doing a lot of grief work in there with clients on all sorts of different levels.
Yeah, definitely. And I think that's what makes it really, really heartbreaking, but really interesting too, is there's so many like different points for intervention and support. There is like the angle of like grief. There's the angle of, was it traumatic? Like processing it as an actual trauma and then finding ways to process the grief. And usually there's many anniversaries for it as well. So many opportunities for potential triggers. And it just gives a lot to work with clients too, knowing that the date of the loss could be coming up, like the date of the potential due dates. So many, just again, potential triggers to work through that it can be really, birthdays, like being around other kids, like so much of it can be hard. And I do think it's really important to get support.
You mentioned that you're noticing pediatricians are sending referrals. Are you noticing then that there's OBGYNs that are also sending referrals for parents? Because the pediatrician, right, you've had the child and so you've gone through the experience, but pregnancy loss would obviously be a bit different. And do you notice that? Are you getting referrals from OBGYNs?
Yeah, that's interesting. I don't know if personally I have seen some, but I have heard from a lot of parents who've said their OBGYN would, recommend counseling to some degree. Yeah, I think that is like just another good area for intervention and another potential for support too. And I do think that, again, like what follows after the loss, whether it's like depression or trauma, is maybe something that isn't potentially screened for as much or in the follow-ups.
So let's talk about a little bit about resources. What are you using that's helping your work with clients?
Yeah, I think one of the best resources that I recommend to everybody is Postpartum Support International. I know I've shared that a lot with my colleagues and with others in the community I know who ask about it. That's where I received my training in perinatal mental health, and they have a lot of good resources for providers, for clinicians. They have recommended screening tools, and they also have a hotline and support. So I really recommend, like, if someone is struggling with depression, anxiety, PTSD, like whatever their loss, all the things they're struggling with, like, connect to others that share your experience. That has become a lot easier, like with telehealth and things being online. And Postpartum Support International has a ton of support groups. And there are even ones that are really specific for loss and infertility. So making sure that maybe if a parent experiences a loss but is a little sensitive about being around pregnant people, like they can have a groups just for them. That is a wonderful resource. The hotline is there. There's an organization in Portland, Baby Blues Connection, that is another great support resource line. I do think finding as well, ways to encourage the parent, the person who's struggling with, like, what resources are in their community. So in Portland, we have a lot of different resources and groups and things like early intervention for the children if the kids need it. And if they don't live in this area, I think just finding, are there any specific providers that maybe have experience in maternal mental health, perinatal mental health, that could be really helpful. And then as well, I think going forward, what I see as the resources are, really specific to each parent, right? Like I do think, support groups, finding ways to connect with others are really helpful. And then, especially here at the trauma clinic, there's a lot of trauma and PTSD diagnoses. So then we're working on, kind of processing that trauma. And then I think as well, like, what are ways that they can engage with their child? Because that's helping the parent-child attachment. That's going to help the child, and that can help just kind of like instill some confidence as well. So looking for things like, are there, mom groups, like play groups, different kind of camps, activities to just be in.
Unique to the client as usual, right? Yeah. I'm backtracking here a little bit, but as you were talking, I was kind of thinking about this. What are some of the risk factors that you notice that would lend themselves to somebody being more susceptible to having a traumatic birth experience? Or not even a birth experience, but a pregnancy experience?
Yeah. Well, I think there's a few different answers, right? Because what could lead to a traumatic birth experience, kind of on the medical lens, like that would be, things like past complicated pregnancies, like past traumatic pregnancies. If there was a C-section, like, there's going to be a high probability of doing that again, and then trying to do it's called a vaginal birth after C-section, like that can lead to complications. As far as like where I'm looking from the mental health lens, getting into what could be a risk factor for a mood and anxiety disorder or trauma. And again, it doesn't necessarily mean a complicated or traumatic birth is going to lead to PTSD, of course. So I think looking at like what are the strengths and like protective factors, resiliency the parent has, if they don't have a lot of coping skills, if they don't have a lot of protective factors, like that can be a risk factor. Having any previous mental health diagnoses or a history of it in the family can be a risk factor. There's a great model for assessments of working with perinatal mental health called the earthquake assessment model, which I think can also be applied to like any other mental health as well. And even if someone isn't pregnant, is you look at kind of what are the fault lines, right? Like what are the things that lays the foundation of this parent? Like what was their childhood experience like, their family? Are there any diagnoses that run in the family? Like what was her mother's birth like, if she knew? And then when you look at kind of the tremors, right, or the kind of things leading up to an earthquake, would be any big traumatic events like in this person's life. So kind of doing a little information gathering there. So any of those, potential risk factors could be previous diagnosis, previous pregnancy loss, pregnancy complications, and then in the environment, not feeling like you've been heard or listened to or seen. Those feelings, feeling powerless, like feeling invisible, not being cared for. Those were what I've read in a lot of studies are kind of predisposed to seeing it as a traumatic experience, is like how you're treated.
That kind of just brought up something else that we've talked about before. I think you and I have even talked about this before, just that there are also then groups of people who are, by the nature of our healthcare system right now, marginalized the minute that they step in the door. So we've got members of the trans community and the BIPOC community who are also at risk. Maybe even more so, right? Or definitely even more so because of that, in addition to just the general experience of pregnancy.
Yeah, that is definitely something as well. Anyone who feels that they're maybe being discriminated against as soon as they walk into the door. I definitely think parents who are trans, part of the queer community, parents, Black mothers, anyone with a disability, there can definitely be a lot of prejudice that can happen, and being treated that way, of course, it feels horrible. And then during the birth experience is a time when I've read so many descriptions where it feels like that your body like isn't really yours. People are kind of grabbing you without your consent, like not touching, like kind of touching you, doing things without telling you, not giving you information, and a lot of rough kind of attitudes of, hey, stop screaming or stop crying, like this isn't that bad. And I do think because of that, like some of those risk factors of being any kind of marginalized identity is going to be a higher chance of that happening. And feeling as well, sometimes anyone who doesn't feel like a kind of like anyone who feels like maybe a non-traditional parent in some way, like parents who are really young or maybe older or like lower socioeconomic class, not English speaking, of course, and what I've heard as well, like a lot of women and parents from maybe other cultures who are here in the United States who have a very different way of like doing birth or delivery in their culture, and now are put into an environment that feels really different and like not what they're expecting or used to, and not really having your voice heard at all. There's also, for PTSD in particular, having a personal experience of sexual assault, particularly childhood sexual abuse, is correlated with being a pretty strong risk factor to having a traumatic experience during pregnancy. So in those cases, I think it can be so helpful to get support before the birth, like to be able to kind of make a good plan going into it.
It's kind of amazing that this huge event, well, yes, pretty common in the grand scheme of things, this huge event has all of these risk factors and all of these potential things that could be troublesome or cause issues and whatnot, and it's just not talked about.
Yeah, I think that's definitely true. Again, it's either no one really asks about it, or something that I've heard many times repeated as well is they feel like no one really wants to hear about it. They feel like, I've told this story and my friends, like, they're over it. Like, they don't want to hear it anymore.
I can feel the emotion in my body as you're talking about that. All right. Well, shifting a little bit and kind of going to the other side of things, you do this work. I know you love it. And you work with a lot of different people and a lot of different experiences. But what's special for you about this population? Like, what's the most rewarding part of this population for you?
Yeah. I think, of course, when someone is able to have a wanted pregnancy and have a successful birth story and have a healthy baby, like that, I absolutely adore to see. I've had a few clients who have, gone through either infertility or like a past loss and trauma, and then they have, gotten pregnant again. And since now I'm on telehealth, like I can see the baby like on Zoom, or like we prepare, for their first birthday party and kind of process things. And that's always really enjoyable. I don't have kids myself and I'm like not planning on it, but I do love them. And I love my like niece and nephews, and I love seeing kids and having them in my life. So that's always really wonderful. And just, I think, giving a voice to like this person who went through this experience and again feels like everyone, just wants to see the baby and like all the attention's on the baby, and like my entire story was missed. And like I feel really good about just saying like, well, I'm here for you. Like I'm your support. So that's really great. And I love as well, like just anytime someone, like women, any marginalized population gets to like take control of their reproductive care is like very exciting to me. If someone, is able to have a planned pregnancy that they want, if they choose a termination and are able to do that and it improves their life, just seeing people like get to have that power and control over like the most intimate and like important thing with your body is, yeah, it's really cool to see.
It's beautiful.
Yeah.
Really. Erin, thank you so much for sharing with us about what you do and the type of work that you're interested in. Hopefully this will raise some of that awareness that we've talked about is lacking currently. Erin, I know you have a training that's up on Kalos around perinatal care. Can you tell us a little bit about it?
Yeah, I have a training up there that is a introduction to perinatal mental health, where I go into a little more in depth into the definitions of perinatal mood and anxiety disorders, pregnancy loss and trauma. And there are some more like statistics up there about specifics and resources and, recommendations for interventions. So that's kind of a more in-depth formal look at it.
Thank you. Well, as a reminder, this is Erin Fanshier. She's an LCSW, and her training is up on Kalos around perinatal care.